Okay, friends, family, and loved ones, this is Dr. Lance with SF Heal, and I am stoked to be here with Dr. Claire Graser today. We are hoping to continue connecting the health and healing world to more of itself by highlighting the health providers of San Francisco, particularly learning more about what their wins have been, their challenges, what strategies they've used to overcome their challenges, and to learn more about each individual practitioner so that those who are looking for them can find them and we can build a bigger village to better serve our own patients. So thanks, Dr. Claire, for being with us today. Dr. Claire's background, I will run through and then give her the mic to kind of explain in more detail about how she's gotten to where she is currently. She's a doctor of naturopathic medicine or naturopathic doctor from Bastyr University. And if those who aren't aware, Bastyr is a pretty prestigious university in general, particularly in integrative medicine, naturopathy, and acupuncture. And a lot of people who are moving the needle in functional medicine have come from and influenced that place. She did some time at the Osher Center at UCSF, worked at SF Naturopathic Medicine, and now has been for about 8 years or so at B12 Love, serving women's health and a broad scope of needs. So I'm going to give her the chance to expand and dive in, and then we'll just transition into a more natural conversation about what you're doing these days.
Okay, thank you so much. I'm glad to be
Yeah.
here. So I came here in 2012 from Seattle, where I graduated from Bastyr. And I came to San Francisco just because I think it's such a beautiful place. I always wanted to live here when I was growing up. So I was like, I'm just going to come start a practice. I've worked here in various capacities in different businesses, but I've been with B12 Love now for quite a while, and we just started to offer patient care with B12 Love in the Marina in the last year or so. So it's been nice to be here. And before I was more in the Potrero Hill neighborhood, which was really great too. But this is kind of a new area for me, and I'm happy to be establishing a good referral network here too. I do see mostly patients with women's health issues, and that could be anywhere from, perimenopause or menopausal issues and doing bioidentical hormone therapy in the best way we know how. I also see patients with chronic UTIs and interstitial cystitis, endometriosis, polycystic ovarian syndrome, people with fertility issues. And I do a lot of work with GI health, as many naturopathic doctors do, but kind of that intersection of digestive issues and women's health is a specific area of mine.
Yeah. How did you originally find naturopathy? Because that's not necessarily mainstream. As a chiropractor, I'm also super uniquely positioned to understand that you may have had some things happen in your life that pushed you out of mainstream, and I'd love to hear what the backstory was to get you into that.
Yeah, I think I first heard about it actually when I was in high school. I think my grandpa was seeing a naturopathic doctor and my mom told me about it.
Yeah.
I had always been interested in medicine, but I really didn't want to work in a hospital setting. And I was really interested in nutrition and botanical medicine and being physically active and just living a lifestyle that promotes optimal wellness, really. So when I heard about naturopathic medicine, I was like, oh, this combines pretty much everything I'm interested in. And now I can be a doctor in the way that I want to be.
That's amazing. I've never heard it put that way. That's cool. It's so even in high school, you were aware of this type of approach to health and medicine, and it's been passed down generationally for you. That's amazing. What was home for you originally? Where'd you grow up?
Northeastern Washington in
Oh,
Republic,
yeah.
Washington. Yeah, it's pretty close to British Columbia. So
Yeah. And what was the draw to SF? You said you'd always wanted to move here. I mean, I also grew up only 2 hours away, but San Francisco to me was always like a Disneyland type of place. Like I
mhm.
would love to end up there somehow. And yeah,
Yeah.
did you visit and know about it or just hear about
Yeah,
it?
we had a family friend that lived here, so we visited often growing up, and it's just so beautiful and good air, even though it's
Yeah.
a city and
Yeah.
it's a
Most years.
city, but not too huge. And I like the hills too. I've almost never lived in flat places because I just feel claustrophobic. I always need to like get up on top of something and get a view.
Yeah, totally. I just rode to Hawk Hill the other day for the first time in a long time, and like getting up there and looking back at the bridge in the city, it's just a reminder of like how on earth can all of this exist in such a small perimeter? Like, I feel like we
Mhm.
have the best of the best all within 20-mile radius. It's crazy.
Yeah.
This show particularly is for like other providers. Some people who are potentially going to become patients someday might come across this and use this to get to know us, but it's also like for other providers to understand how they would relate to you and how they could collaborate with you. And so when I ask questions like this one, it's from like almost a business owner, professional standpoint. Like, was you coming to San Francisco as an ND also just serendipitous because there is a market here, or is there enough of a market for ND, like naturopathic services, across the US now that like you could open almost anywhere, and because the need is so great that you could just thrive?
As a naturopathic doctor, still you have to consider where you might live because we aren't licensed in all states in the US.
Yeah.
Actually, there are 2 or 3 states where it's illegal for us to practice.
Oh my gosh.
But we're
Okay.
legal in California and have been for, I don't know, 15, so more than that years,
Yeah.
actually licensed here. So if I didn't want to be in a state where I felt in danger of practicing or where I had to do consultation rather than use kind of a wider breadth of the skills that I had practiced.
Yeah.
Though still California has a more narrow scope than we have in Washington, Oregon, Arizona,
Hmm.
Hawaii. We are trained really as general practitioners, and we're trained to look at things from a naturopathic and functional perspective. But we are trained in pharmacology and,
Hmm.
ordering all kinds of labs and diagnostic imaging. And in Washington, many of my classmates ended up being in more of a primary care capacity. So California, it was a decision to come here. It was partly a lifestyle decision for me, but there aren't as many NDs here, which I thought was a good thing. And even in San Francisco, I was kind of, even to this day, there are more than there used to be. But I think because we've had a harder time getting contracted with insurance companies here. In fact, I really don't know any insurance companies that will
Hmm.
take naturopathic doctors currently. So, being a cash-based practice and
Yeah.
having a little more limited scope than we had in other states, I think there may be not as many of us here, but yeah, I always thought it was a great market and a beautiful place to live and just where
Yeah.
I wanted to be. So,
Cool. I resonate with the differing scopes of practice in differing states, because even in chiropractic, we have to learn how to do rectal exams and deliver babies. And in Oregon, there are maybe you'll be a chiropractor that's the only chiropractor in a 200-mile radius, and then might not be any other healthcare providers in the whole place. So it's like they're trying to have someone at least who knows the anatomy to help out, and not to knock them, because I know if they're out there doing it, they're probably trained and they've done the continuing ed to specialize. But depends on where you go, what's going to be expected of you.
mhm.
um, so now, having been in San Francisco for as long as you have, I know that you've specialized in women's health. The 3 questions we like to ask is like, what's the biggest win you've experienced in health and healing as a professional? What's the biggest challenge, and what's the strategies that you've used to overcome some of the challenges? And that kind of winds into also like, who are the people that you've worked with best? And the fuel behind that is, if another health and healing practitioner or provider in San Francisco is looking to refer somebody to somebody, how would they know that they're referring to you? To wrap all that into a simple question, what have been the biggest wins, or one of the highlight stories of a success you've had working with a patient that kind of encompasses the people that you work with best?
I don't know, like if one specific thing or person pops out in my mind, but I think just generally, when I lived in Seattle, actually, I was really interested in physical medicine. So I was working while I went to school. I was doing massage therapy in a PT practice, and the physical therapist specialized in the pelvis, basically. So
Mm-hmm.
she also had another massage therapist there that was doing my abdominal massage. So I
Mm-hmm.
didn't become certified in that, but I did learn a lot from those people. And I took additional training in visceral manipulation and craniosacral therapy. So I really worked a lot with people on abdominopelvic issues, and that kind of led into people that had chronic pelvic pain. So I
Mm-hmm.
thought when I moved here that might be one of my areas of interest. And I did start seeing seeing people with chronic pelvic pain. I would say that is one of my areas of specialty, but I don't know exactly how I started working with it, but maybe it just came to a point where it's like, it's really challenging, like especially interstitial cystitis or painful bladder syndrome. I think I would get to a certain point where we could manage things for many people pretty successfully, but it just never seemed like it totally went away. Or, some people, I would get to a certain point where it was helping for a while, like people with Ehlers-Danlos syndrome, or like endometriosis, Ehlers-Danlos, or some kind of connective tissue hypermobility syndrome, and digestive issues that like there's just like you could only go so far before you're like, I can't fix your tissue structure. So I think maybe it was some of those cases where I like saw people and we got to a certain place, but I couldn't totally help them resolve it. So I think in some ways, like I expanded a little bit more to like vaginitis and perimenopause and menopause and, people with endo that didn't have other complications. And PCOS, which is something that I actually personally have. So I work a lot with blood sugar balance and fertility, and people with PCOS, and stress, of course, is a big piece of that. But so I kind of moved in other directions, but lately I've actually been coming back to IC and chronic UTIs. And I've been working with a nurse practitioner, Ruth Chris, who is doing really amazing work to actually kind of cure, like get to a resolution of those issues, because she's really found that even, for instance, with interstitial cystitis, where people supposedly they don't actually have an infection, it's just an inflammation of the bladder, that when you actually break down the biofilms that have built up over like the 20 years that they've been getting UTIs and taking antibiotics that aren't really the right ones. And so I've been working with her.
Is she an ND also?
She's a nurse practitioner, but she's just been doing this for like 30 years. And so we're using like next generation DNA testing, the urine and vaginal swabs. And, if they have male partners, their semen and their urine, and, just really getting into it, and doing really specific testing to see like what kinds of biofilms they might be producing based on their genetics. And so anyway, that's just a really cool full circle thing that I'm kind of in the beginning of my apprenticeship with her, I guess. Coming back to that has been a good success story, I think.
Ruth Chris is what you said her name was?
It's Ruth, and then last name Kriz.
Cool. I'll be looking her up. Would you mind expanding a little bit on, you said the PCOS and you're linking blood sugar and stress, for those that may not have heard that relationship in the past? Would you mind just talking about that slightly?
Yeah, well, the PCOS, polycystic ovarian syndrome, is characterized by irregular menses, cysts on the ovaries, or signs and symptoms of androgens, high androgens. So it could be like acne, oily skin, hair loss from the head, excessive hair growth on the body. I believe it's the most common cause of infertility actually in the US. There are kind of different types of PCOS, but the majority of people with PCOS, it's a multifactorial condition that includes environmental, genetic, and lifestyle factors. But the majority of people do have insulin resistance, and that partly is genetic. Actually, it's not just like, oh, they've been eating sugar their whole life. It can be exacerbated by that, of course, but and that actually is what drives the higher production of testosterone and other androgens. And that's what causes a lot of the symptoms of irregular periods and things like that. So I'd say that's the majority of cases, but then there are a bunch of other people that kind of don't fit that typical PCOS profile, where we find that it could be still a combination of things, but I have a number of patients that have really high levels of DHEA, which is an ovarian hormone, but also an adrenal hormone. And I think of it as more of an adrenal marker. So when DHEA is really high, that can be associated with stress. And of course, stress can influence our blood sugar balance and vice versa. So there's a connection there too.
Yeah, cool. Thank you. that paints a massive picture for anyone who's struggling with that and trying to go into mainstream options and running into dead ends, just to show them, like, even from the opener of environmental, genetic, lifestyle, there's a whole world you can enter there, but then the markers that you can measure to show
Mhm.
whether it's stress related, insulin resistance related. Again, that's just options for people. That's, I know PCOS can just be a game changer for people, and it changes the game for the worse when they don't have answers or people who can support them properly. And when you actually feel supported and you have more options, it can give you hope. So now, to circle back to, like, that was your biggest win. What has been, if you're talking to a bunch of professionals who are working in health and healing in San Francisco, what is a challenge that you have experienced, and what are some of the strategies or lessons that you've learned that you'd want to share, having experienced it, overcome it, and moved forward?
I think just from probably the business side of things, it is really challenging, and probably many integrative practitioners experience this, that maybe their services are not well covered by insurance or reimbursed, and or may not be eligible for reimbursement. Anyway, just the business side of things, I think it's been, I would say probably that has been the biggest challenge, is just establishing myself as a practitioner in a new place from scratch
Yeah.
and making
Uh-huh.
of it. And I think and it's not been it's not been something that I haven't been able to overcome or work with.
Mhm.
Everyone has this challenge of, becoming who they are, establishing themselves in their professional
Yeah.
career. But I would say that really developing um, a good referral network has really been my primary strategy. I'm not really, I don't know. I mean, I can always hire someone to help me with my website or SEO or marketing strategies, but I'm not an expert in marketing. But I
Mhm.
am an expert in person to person communication and building relationships, and finding win-win situations where we can help each other. And, as far as our patients go, really have the best outcomes when we have the people that are serving them in the best way they need. So I
Yeah.
think that has been probably one of the best ways, is just to, yeah, have a good and specific referral network of people that I trust.
I love that. That's what we're trying to overcome also, is like breaking down the barriers of some of the best in the world. Probably, if you're in San Francisco and practicing as long as you have been, you would have been held to a pretty high standard of performance and getting results, because San Francisco just, if it doesn't work, it doesn't work in it, and people have to move out of this city on a pretty regular basis. And if we can help expose all the people like you who have high levels of skill, a ton of experience, and because of probably doubling down on your education and your expertise, and not leaning so hard on the marketing, I mean, I would love to help you find more people to find you. Is there anything else you'd like to rap about, or anything you'd like to share with folks out there that are kind of dealing with what you're dealing with what I'm dealing with, and looking to connect, or who have other questions, who want to reach out to you?
Yeah, I really appreciate the opportunities like this to talk to each other. And I know you have the I don't know if it's a little more patient oriented. I haven't been there yet, but the dinner with the doctors that you guys
Dinner with the
do.
docs. Yeah,
Anyway,
yeah.
just opportunities to get together. I used to be in BNI, and I think I just needed, I wanted to not just have one of each healthcare professional represented.
Yeah.
I had a great experience too, but I think just seeking out and going to, continuing to talk to each other and keep our network strong. I think that's good. Yeah. And I'm here, on Union Street in the Marina, Union and Fillmore at B12Love. And I really focused on the patient care aspect of my practice, but we also do IV nutrient therapy and intramuscular injections. And that's been also a really amazing addition to the, face-to-face patient care that I'm doing, because people have a lot of need for these nutrients too. And I'd say one of the really great things that we've been doing is helping people a lot with long COVID. So I would just put that out
Mm,
there, that the nutrients for mitochondrial support that we have, doing IV glutathione to reduce inflammation and really support central nervous system function, addressing brain fog, fatigue, and other neurological symptoms. I would say that's another thing that I would just shout out. But yeah.
Cool. I want to actually highlight something too, because a lot of people think it takes a whole ton of time and resources to be able to get care like this. But I know you guys have made a priority out of accessibility. Can you just touch on like what the process is of what it would look like if someone came to you with an issue? What would the day one look like?
Yeah, I mean, for the IVs and injections, one of our goals was to make it more accessible without having to have a, long-term doctor-patient relationship. So we do screen all of our patients to make sure they're safe for the services that we're giving them. But really, these are very safe nutrients, and we are well trained to recognize anyone that might not be a candidate. But most people are a candidate, and we do give specific recommendations, even though we have a preset menu. But you can just walk in, and that's the beauty of it. As for the naturopathic care and consultations, we just basically set you up in our medical record system, send you a couple of intake forms, and we have a full comprehensive intake, but we also have just even a 20 or 40 minute, more brief visit options. If you just want to get a basic panel of labs, you're feeling good overall, or maybe you're just a little tired and you don't really have a condition that you're working with, but you just want to be proactive and make sure that you're as healthy as you can be. We can run a basic blood panel. We can go over your health history and your family history and make sure there, are things that if you have something in your history based on what your genetics are, or, what your current environment may be that you may or may not have control over. We can offer those kind of just quick levels of appointments that I think a lot of functional medicine practitioners are, charging hundreds and hundreds of dollars for the first visit. And so it just can be a barrier to entry for some. And so one of our big goals with our practice at B12 Love is to really make this accessible for people.
That's amazing. So I didn't even realize that B12 Love had such a depth of care, because I would see B12 and I thought it was B12 shots. And I know other places that's all they do. And so helping now, even for myself, to be able to advocate for people to be able to come see you and receive naturopathic care, and to have someone who's qualified to know when you need that, when, IV shots up front could be enough for now, and to even just to screen them through. That's really nice. So thank you for sharing all of this. If someone wanted to reach out, is there a website to contact you or anything on socials that they could follow you?
Yeah, I think probably just going to b12love.com and then going to our Lux services, and then looking at naturopathic providers is the best way to schedule with me.
Awesome. Okay, perfect. Well, thanks for taking the time today. And everyone out there listening, thank you again. We'll be releasing these about weekly or so. And if you have questions, you can reach out to us through Instagram at Goga Chiro. Obviously, contact Dr. Claire through b12love.com. And we will see you soon. Thank you so much. Enjoy your week.